Folks who are just joining now, I am here with Jena with one N, as you probably know her on Substack, Jena Martin, who is the producer, reporter, narrativizer,
Creator, yeah.
all the roles. Creator, thank you. There we go. The creator and the many hat wearer behind the podcast, The Memory Hole. One of my favorite podcasts I have discovered in recent years. Truly, I'm just like obsessed with The Memory Hole.
Great.
Broadly, Jena, it's about the pseudoscience of recovered memories and how this took off in the 90s with all the kind of like the fear of satanic ritual abuse and the courage, that book, The Courage to Heal. You report on this so beautifully. But now it's really kind of developed a research life of its own, and you've explored so many other different topics through this podcast. Can you talk a bit about its origins and kind of where it's gotten to?
Yeah. So I started the podcast in 2023. And, I'm kind of a compulsive podcast listener. So I felt very familiar with podcast conventions and, audio storytelling. And I guess the very origin of it started. I took an essay writing class during the pandemic, and one of the prompts they had up was about shame and sort of talking
Mm,
about that. And almost instantly, that popped into my mind was the era when I was maybe 19, and that kind of talking about shame and therapy speak was everywhere. That my friends and then
mm,
roommates were always processing stuff, and then I remembered, that go along with that is feeling a little bit embarrassed about my experiences during that time. And so I wrote about how when I started college, the people that I met up with and then ended up rooming with were all very wrapped up in this hunt for recovered memories of, and then it was a little bit vague at first, like what were the memories? And they started sort of talking about it as the abuse, in capital letters.
mhm.
And then it gradually emerged that the specific abuse and trauma was childhood sexual abuse. And so my roommates were all seeing the same therapist. Gradually, they went to see group therapy, and maybe a couple times a week they would go see their therapist. And so processing all of these working on developing memories. And so, if in season one, I talk about kind of the expanding category of what was a memory back then. If
Yeah,
you just felt awkward, that was somehow a memory, or if you felt like the example that I gave was I crossed into the room and I couldn't remember what I was about to say. And my roommates looked at me and said, Jena, that's an example. Their therapist says that this is an example of um, repressed trauma, repression of sexual abuse. Yeah, so I remember feeling, and up until that point, I had been kind of going along with it. I was very eager to
yeah,
fit in, and I thought, sure, I don't. What would I know better than a therapist and my roommates who were reading all the popular books in the self-help section? And so,
yeah,
but when they said that, like forgetting what you're about to say is a sign of sexual abuse, I thought that just didn't fit right. It didn't make
yeah.
sense. And I feel fortunate, I never kind of created a memory in this whole
Mm.
process. And so looking back, it's with this sort of vague embarrassment that I even at one point had wanted that. I kind of thought, oh, if I could remember these things, then I would fit in better with my friends and maybe all my life would make a lot more sense. So I was really following a lot of the patterns of the recovered memory movement as it went along. So that was
Yeah,
the origin. And then
yeah.
from that little seed and memory of it, I started to write a novel. And then
Mm,
from that novel, then I wrote this essay. And then, gradually I thought, wouldn't it be fun to turn the essay into a podcast? So that's where the first season came from. I really had kind of 6 parts in mind right away. So I didn't do season one intending to do season two, but season one was really to sort of an explainer for anyone about the recovered memory movement.
gotcha. Well, I mean, you touch on this in the podcast too. You can really see the ghost of Freud as some like late 19th century, early 20th century ideas coming back with the recovered memories movement. And I think you get into the concept of iatrogenic harm and how young women engage with a lot of these. And this is my term. I'm not even going to put this in anyone else's mouth, but medical fads. You
Yeah.
know, and the kind of the how this the diagnostic criteria for a certain disorder, or you know, for a condition like traumatized by memory, just is ever expanding. It's getting wider and wider, and the trawling net can catch more and more people. And I think it's interesting. It's always been interesting to me the way that young women, especially, respond to that kind of phenomenon. And we'll get into that a bit more, I think, probably soon. But I want to talk a little bit about how this podcast is so unique to me because its creator is not only a journalist, an essayist, a novelist, but you're a doctor, you're a pathologist, you're an MD, making this. And I'm really interested in hearing about how your background in pathology informed the making of this podcast.
Well, probably until this season, I would have said that it didn't. My life is pretty siloed, and so. But this season I wanted to really focus on that. You were talking about medical trends and diagnosis, so I really wanted to talk about fads and
Mhm.
fads in diagnosis, fads in psychological understanding. So, and a lot of that comes out of categorization. How do we categorize and classify our mental states? You know, how is that done sort of by the institutions that we've created? It really, in very recent times, right, in the last 175 years, you know, this whole diagnostic um, explanations have arisen. So as soon as I started to realize it was all about categorization and classification, that's when my natural inclination as a pathologist really kicked in because um, you know, pathology is a hard field of medicine to talk about. Not a lot of people, other than, and even doctors, don't really know what we do. It's kind of like a black box
Yeah.
in the hospital. You know, you send parts of people into the black box, you know, your blood specimen or a biopsy, and then it emerges with a written name, you know. So, but people don't really consider what happens inside the black box. So, but for me, the real, almost like philosophy of pathology is like categorizing, you know, and so I learned a lot this season in
Yeah.
particular about, you know, like going back to Plato and the idea
Yeah.
of that we're carving nature at the joints, meaning that we're making clean distinctions based on reality. And so, oh, my phone is kind of coming off. So that was what I realized is my total bent. Like I always want to classify. I want to find like what's the real organic kind of scientific realist nature of things, but that totally breaks down when you're getting into um, mental illness, behavioral disorders, even really just classifying humans. A lot of clinical medicine is also socially constructed rather than kind of carved at the joint. So just to bring it back to the question of how does my work as a pathologist inform this, um, you know, either I like to classify things this way because I am a pathologist, or I start, you know, that's what drew me into this kind of thing, always wanting to understand the root cause. Um,
Yeah. It,
so-
you know, thinking about like empiricism and the platonic tendency to of humans to want to carve nature at the joints. It's so like this is what I so love about season 2 of your podcast, because you get into the fact that if you're going to narrate at all, it's going to be unreliable to some
yeah.
extent, right? You get into the trouble of subjectivity, and I think subjectivity really starts to muddy things when I'm the I'm the subject reporting on myself. How do you? I mean, how did you kind of wade into that territory, Jenna? Like that, it just feels so. It feels different, right, from the kind of the lab based pathology. Is this a cancerous cell or is it not?
Oh, yeah.
But maybe it has more in common with that than I want to believe. I don't know. What do you think about that? The murkiness of behavioral health.
Well, you know, there's a reason I chose to not interact with patients and deal with kind of the murkiness
Yeah.
of people because it is really challenging. And, I think I have I don't even mean this in a critical way, but I am more tending to be like judgmental in that I decide on stuff, and so
Yeah,
it's
like you
harder
make a
for,
decision, you make a choice.
yeah. Yeah, so it's hard for me to, to not wanna sort of summarize and say, "Okay, it's this label," and wanna move on. So, I think, like, the what has given me the license to talk about it with this podcast is that I was affected, but, I don't consider myself particularly damaged by my
Mm,
interactions with the recovered memory movement, so I feel like I have some stake in it, but, um what's the, standpoint epistemology or whatever, that I have some
yeah,
way I can talk about this, but that I don't feel victimized by the recovered memory movement, just still really fascinated by, being caught up in that. I don't know if that answers
yeah.
your
Oh,
question.
it does, and I relate. I relate in different ways, but yes, definitely. Um Going back to the kind of the 3 seasons of the podcast that are out now, I know I mentioned in brief season 1 was a deep dive into, like, the social contagion and pseudoscience of recovered memories and how it
Mhm.
was huge in the '90s and how I think my cohort, I'll just say this, my cohort of millennials, if you were born between '88, let's say, and '93, oh man, this really impacted us. This really
Oh,
impacted our, for lack of a better term, I guess I'll use a German one, Weltanschauung, our world outlook, but we don't really know, we weren't really conscious, and living through the satanic ritual abuse panic
yeah.
and the recovered memories panic. But that kind of that contagion, that contagious thinking, wow, it really, really is something
Oh,
that I think has impacted my generational cohort intensely. So it's fascinating. Like, this is the reason I was like, I gotta listen to this podcast right now because there was a time when everyone was recovering memories, like
yeah.
Scientology style. So that's season one. But then season two, what kept me really hooked was that you're doing this kind of analysis of memory consciousness and behavioral coercion through a literary lens. You talk about how, for instance, consciousness in a Jane Austen novel, right? The way Jane Austen is writing,
Yeah.
like, the human individual, you ostensibly, like, I guess she's, well, yeah, pre-Freudianism,
Mhm.
pre is the sense of a human individual consciousness. Um, at least before that reached the public wherewithal. That is so different, right, from the novels from, I don't know, just, like, name a
Yeah.
post-war American novel, right,
Right.
and how the sensitive young man conceives of himself after World War II versus how,
Right.
like, Elizabeth Bennet conceives of herself in Pride and Prejudice. I loved that. Season 3 is now you're investigating the concept of hysteria, like,
Mhm.
the sociocultural concept of that. You're going through history and telling us about it. I am so fascinated by this, Jenna. Can you just talk a little bit about the themes for each season, how you decided on them, your experience reporting them? Because I think they flow so beautifully.
Thanks. Okay, so season 1, like I said, was really just me sort of like not enough people know about this era. People hadn't
Mhm.
heard about it, or that people would just say, "Oh, the satanic panic and the daycare kids," and these kind of broad
Yeah.
sweeps. But I feel like I was coming at it from a different perspective, which was kind of the feminist experience. The Courage to
Mhm.
Heal was very profoundly a feminist text. And that to me gave it this kind of seriousness and importance. When I was like 19, I thought, oh, this really makes sense. And I'm part of like a big movement, and
Right. Right.
so I wanted to talk about it from that point of view, and also a little bit detached, like how did this happen? Can we recover memories? I talked to memory experts, and I talked to some really wise journalists and academics who were kind of prolific during that time, but now are no longer heard from, like Mark Pendergrast and then Frederick
Mm.
Cruz, who passed away since that first season. But
That interview was amazing, by the way.
I
I could
thank
not
you.
get over the cruise interview. Oh my god,
I
the
wish I
Freudian
could talk
slipper.
to
Yeah.
him so many more times because for people who haven't listened, he was a, I don't know, intellectual Freudian. He brought
Mhm.
Freudian analysis to the literary department, and then he had a change of heart, change of mind.
Mhm.
He saw Freud as I always remember what he said. He called him like the guileful storyteller, and I still
Mm,
think that our society is caught up in that kind of sense that, by investing in looking deep in ourselves is like this deep romantic mystery that we're all still caught up in. But so he had some really interesting perspectives. And then the second season really arose because I was just so irritated by the persistence of repression, so that
mhm.
as an idea, and that the
Yep,
way that we handle our memories, it's just seen as this natural thing. Like, oh, something's really traumatic, I'm going to repress it and block it out. I mean, now I'm not a memory scientist, but there's enough information out there that this is just not the way that our minds process memories.
right.
We do forget stuff, but people
Sure.
use the word repression, and it's a Freudian term. And one of the memory scientists that I spoke with for season 1, he said, none of us have ever seen a repressed memory, because in order for it to exist, it has to have been recovered by the person and then, shared. And so it's terms that were used without
That's
any
yeah,
kind of investigation. So,
yeah.
so I felt like, oh, this. Once I had kind of resolved all this after season 1, I thought, well, why is this idea still so persistent? And as I was writing my novel, I was reading a lot in mystery and thriller genres, and I was like, they always keep, many of them use kind of these hackneyed ideas about memory. The
Mhm,
heroine experienced something terrible, unspeakable. Usually, kind of
mhm.
insinuation is that it was sexual, um, and then midway through the book, she remembers, and that is this important plot point. So I started thinking that perhaps one of the reasons repression persists as this handy explanation is because of storytelling and narrative. And it really
Mm.
is the way that we understand ourselves now. Yeah, for that season, I spoke to, I think, one of our mutually favorite authors, Dan Shawn. Um, and
Who's just
yeah,
man, he's yeah, go on, he's an
well,
expert
his
on
book,
this
Ill
stuff.
Will, is really another great exploration
Exploration.
of the recovered memory movement, and how I just love, oh, that is one of my all time favorite books. I mean, really,
It's a
and I've
brilliant
listened
book.
to it and read it. I can't get enough of it. Yeah.
Purchase this
We
book. Yeah,
both
it's
highly
amazing.
recommend that. Yeah.
Yes.
But when I actually spoke to him for season 2, in one of the last episodes, and I thought he was so funny. He said, it's just kind of a silly idea that a therapist is going to be able to have this sort of special key to unlock your mind. Um,
Oh, and then that's why I think the therapist in Ill Will is it's
yes.
kinda almost a tragicomic figure
Oh, well,
'cause
everyone
he
in
does
that
not
book
have
is
his
so
own shit in
painful.
order.
Yeah.
It is
Yes.
yeah, it is.
Yeah, so Dan weaves in all the stuff about, the Satanic Panic also,
Yeah.
so I just thought that was just a brilliant book.
Yes, it is.
And then in the 3rd season, it's interesting that you characterize it as hysteria, but for me, what I really wanted with the 3rd season was to go in and face and take apart the idea of social contagion and the
Mm.
and the symptom pool, which is this
Mm.
idea. It's a complex metaphor that I came across in the works of a medical historian, Edward Shorter, who I read about him and read parts of his book for season 1. And then I read the whole thing in preparation for season 3 several times because it's pretty dense, and it's difficult to do a medical history of. The book is called From Paralysis to Fatigue, about psychosomatic illness. And so,
Mm.
how can you go back and look in history about what are the truths of people's illnesses? You can't, without, you
Right.
don't have accurate medical records. But he kind of created his own metaphor called the symptom pool. And the symptom pool, what he called it, was a society's unconscious memory of how to behave when ill. So, to really get a handle on a symptom pool, I went and looked at other cultures, culture-bound
Mhm.
illnesses, and then also diseases in history, and really the prototype psychosomatic illness being hysteria. The one that we can clearly look at and say, "Oh, people aren't having fits and collapsing and paralysis now, why not? So that's a great way to evaluate that.
Mm. Yeah, okay, thank you for that clarification there too. I think truly the reason I um cottoned onto the concept of hysteria so much with season 3 is because I'm always sometimes, not always, but sometimes I'm thinking in 19th century terms when it comes to psychoanalysis because I really appreciate the history of psychoanalysis. I grew up that
Mhm.
way. I grew up with a parent who really really appreciates Carl Jung and is a scholar of Carl Jung, and so I am thinking in Freudian terms of hysterical conversion, right? Of
Uh-huh.
the bodily metaphor for the mental ailment. And I'm thinking also of, now this is just kind of shorthand, right? But the hysteria as a descriptor for a kind of mental contagion, right? So when you're talking
Yeah.
about like a moral
Yes.
panic or a public hysteria, like that's the term that always gets kind of grafted onto
It
this
still
phenomenon of
does.
everyone's
Yeah.
freaking out about this, or yeah. It still does, and I think that you do such a great job, especially in the episode where you're interviewing Jenny Lightweiss Goff, where you guys talk about how the progressive treatment of hysteria in the 19th and early 20th centuries, and how, like, it seems, oh my god, so misogynistic. All these doctors crowded around this young miserable woman and
Yes.
trying to whatever relieve her of her pain with all these like terrifying contraptions. And in fact, it's not so simple as like these
Right.
vile men, this innocent girl. There was real care. And I'm wondering if you can talk a little bit more about that dynamic, right? The how hysteria got gendered, right? And then
Mm.
maybe how there are some things about hysteria, the concept of hysteria throughout history, that we don't really understand. We just see it as totally pejorative or totally, I
Yeah.
don't know,
Yeah.
a way to write people off. Yeah.
Yeah, exactly. And it still is used that way, so it's
Mhm.
kind of like I have to be careful. I feel like just like talking about recovered memories of sexual abuse, in the first season I did a lot more of this, but really clarifying there have been many victims of sexual abuse, women and
Right.
children. This is not
This is
saying anything
real.
about, the reality
Yeah.
of someone's experience. And the same way that I want to acknowledge that hysteria is used as hysterical, dismissal, like hysterical
Yes.
woman, that's just a hysterical, and then, being uh, pedantic, but really often it should just be called histrionic, but
Right.
if we want to be accurate. But yes, so when I first started talking about the history of hysteria this season, I wanted to make sure I wasn't just talking about. I feel like now it gets used as like this kind of feminist rallying cry, like
Right.
don't you dare say that I'm hysterical or don't you dare call women hysterical. And then I just think that allows us to kind of brush over the real medical history, which, medical
Mhm.
history is ugly, whether or not it's misogynistic or, people broadly were treated poorly by physicians because they had
Yes.
little else other than, the power of suggestion at their disposal.
Mm.
Um, and so so the paint the in episode 4, what you're talking about specifically with Jenny Lightweiss Goff is a famous painting, the clinical
Mhm.
lesson at the Salpêtrière, which was a famous hysterical hospital that a famous neurologist, Jean Martin Charcot, had taken over and really turned it into like this kind of wonderful modern science temple in his mind, by his terms, and was
Yeah.
treating these poor women of Paris who came to him with kind of, unhappy lives, emotional distress, and they all became hysterical. It's described as like a
Mm.
circus, and really a petri dish of the example of the symptom pool and of social contagion. How does one act when one's feeling upset? Oh, well, here it is on display before me. And in the painting that we discuss, the there's literally a drawing in the painting showing the posture that the woman is doing. So you can see really how behaviors are being modeled. So, yeah, and so Jenny really, I thought it was great. She made the point that we look at that. I've seen that painting and it gets kind of like dismissed, like, oh,
Mhm.
I've seen people talk about it and say it's a group of all men addressing a woman who's very vulnerable looking. She's
Right.
falling backwards and kind of like looks like she's either fainted or in a trance. You don't really know if you don't know more about the painting. And um and that's seen as misogyny, example of misogyny. But Jenny said, there's care being administered here. We may not agree with that, but it's not as straightforward as saying medical mistreatment, misogyny.
You know, this is something that really fascinates me too, Jenna, because being, extraordinarily hip in the ways I've become to like, here are some medical abuses that happen, right? Here are ways in which public health is like inextricably bound up with population control, with
Right.
like there all these medicine and eugenics, this like very, very troubled history in the United States. And also there are like just innumerable medical professionals who take the Hippocratic Oath incredibly seriously,
Oh,
who
yeah.
who are who like it's not black and white, right? It's like so many individuals who throughout history are like, well, I believe in like empirical science's ability to rid the body of the pathogen, and I
Mhm.
want to help people not have this pathogen. And so, you have this just, I think, fascinating confluence of forces here in like contemporary medicine, where, to go back maybe to a more gendered analysis of it, women like maybe in the 90s coming forth with this with recovered memories, dipping into this symptom pool, this kind of contagious, mental health symptom
Yeah.
pool that is not the most reflective of reality. And then you have a medical establishment that is not only being bottlenecked by like insurance and all the ways that the medical healthcare system is breaking down, but
Yeah.
you have people who sincerely are like, oh, like this is a new thing that's happening, and
Yes.
it's new because we have awareness of it now, and that's why so many people are coming forth. We've heard this before. So many people are
Right.
choosing to do this because we're aware, and I genuinely wanna help these women, they're suffering. And you also have the old kind of like, yes, misogynistic priest and possessed woman kinda like, I've gotta rid this woman of her hysteria. I've gotta rid her of this demon. I've gotta like silence her, right? So you have all of this stuff kind of floating around. Um, and there's no wonder that people are developing like Munchausen's and Munchausen's by proxy, and
Right.
the kind of, I think there's an eros to it too. There's a desire based element here. There's a lot. I'm so
Yeah.
curious what kind of like, if you were to dive
Yeah.
into that kind of gendered analysis of the of medicine's troubled relationship with women, like what would you say?
Well, I think that's interesting, like the idea of because one thing about the symptom pool is that it's driven by the patient and the doctor. And this is also true,
Mhm.
like, and then the next episode of this season, I'm going to talk about the philosopher Ian Hacking. And he talked a lot
Mhm.
about um, the patient being, or in his case, more like an unhappy person coming, and
Yes.
uh,
Yep.
and then seeking an explanation from an expert at an institution or somehow associated with institutions of knowledge. And so then there's like this kind of co-creation that happens, but
Yes.
of a diagnosis and of a label, and because the patient, it's not about culpability. I'm not thinking about that, and but I'm saying more like they want an explanation, they want an answer,
Yes.
and so and they look to that expert to give it to them,
Mhm.
and so it requires a lot of experience and awareness, I think, as the provider to see that for what it is, you know, and that maybe the label can because it's not based on an organic disease. Someone comes, I have a problem, and they say, oh, you have syphilis, or whatever the very specific thing is that you can be treated for. If you have just sort of malaise or other feelings, um, the provider might, you can use the label that's available of the moment. And so these
Mhm.
are always changing, like the labels that are created by for the people, then they reflect back to the provider a different set of symptoms, and the labels are always being changed and shifted. And that's what Hacking called the looping effect.
The looping effect.
But the gendered thing, I mean, because, for most of, modern history, or ancient history, really, physicians were men, and
Mhm.
probably most patients, certainly in this category of the mind, body, psychosomatic, questions have been women. And also, women just have more, reasons to visit the doctor in their lifetime, with menstruation and pregnancy. Um, and so there is a gendered power dynamic happening, but it's shifting now. And so now, I
Mm.
mean, my fear is that as medicine becomes more equal in terms of male female physicians, although that's not true across specialties, so your family medicine doctor, is probably more likely to be a woman, your cardiologist is going to be a man. I mean, broadly
Right.
speaking. And
Right.
so, oh, I just lost my train of thought. Oh, but just overall about how medicine has been losing really steadily since probably the 90s, a lot of credibility. And so
Mm.
the relationship in 1920, when someone would go see their doctor and say, I don't feel good, the doctor would say, you have this, that was much more, the patient said, oh, okay, sure. Now there's less acceptance, less trust, and the symptom pool is kind of changing and breaking down. I'm not really sure how we're going to
Totally.
characterize the moment we're in now, because it's not that male doctor telling the often female patient what is wrong. It's much more
Mhm.
diffuse, and mediated by social media and a lot of forces.
I mean, yeah, I think this there's going back to the platonic piece, right? Like you go to your doctor for teleological reasons. You want a
Yeah,
telos. You're like, this is going on. What's the telos? And by teleological, I mean like an explanation, a past explanation for what's happening right now, right? And
right,
that can almost become kind of like ontological. Like, I'm asking a question about the world, doctor. I am in the world feeling poorly. This makes me feel bad. My body feels this way. Can you interpret these signs for me? I
right.
have this feeling, Jenna, that like it's almost and of course I've spoken to the doctors in my life about this, in my family and outside my family, all this. But like, there's the MD can become kind of like a spiritual leader in a sense, right? Can
Mhm.
occupy that
Yeah,
role of like,
like a
here's
healer.
what's
Yeah,
going like a heal exactly. So like this is what's going on in the world and for you, and I'm going to like interpret these signs for you. And I think when we get into the behavioral health, mental health space, we get into the DSM space, right? This is where
mhm,
things really take off. And you have, I'm just using an example from my life, right? I'm dysphoric, right? I'm ill at ease in my body. Um, and I actually had to blow past I had a very like reasonable therapist who's like, I'm not gonna diagnose you with gender dysphoria. I was like, oh yes, you will. But like that
mhm.
was I insisted on a type of co-creation with her, and
Right,
I was not, and that's when it became a consumer dynamic where I was like, well, you got to
right.
write this. That's really
And
troubling.
that's a new kind of relationship. Yeah,
That's a new kind of exactly, that's a new kind of relationship. But then, going back just to the concept of dysphoria broadly, right? This is my recovered memories. Okay, so I'm feeling broadly dysphoric with my gender. I'm feeling ill at ease in the world as a woman. There's so many reasons that could be happening for me. There's
right,
so many
right.
reasons beyond you've got an endocrine issue. So I felt like when listening to your podcast, I really related, especially to those first season 1 descriptions of the young women, like you and your kind of
Oh,
cohort
yeah.
being like, anything is a memory. Because I was like, well, shit, anything is dysphoria. Anything can fit in this
Interesting.
symptom pool. Yeah. And then iatrogenic issues, right? You discussed this in your podcast as well. um, Iatrogenic, by the way, folks just tuning in, that is unintentional harm caused by the treatment for a disease that maybe does not exist. Um, that's, I think, in this co-creation model, Jenna, that's where the iatrogenic harm can really come up, right? Like, can you
Right.
maybe talk a bit more about iatrogenic issues in the recovered memories movement?
Um, let's think. Because, a lot of recovered memories really fell into the psychological,
Mhm.
psychiatric category, so I think, there were no prescriptions,
Sure.
no procedures, but there were, a lot of instructions to upend your life, to sever contact with family, to be involved in the kind of therapy. When I read about it is really surprising, like 2 to 3 times a week. That would distort anyone's thinking. Group therapy, um, and that was all considered kind of normal, good, and healing. Um, I can't think of any sort of unlike a lot of psychiatric history, it didn't come along with medicine or,
Mhm.
ECT or, electroconvulsive therapy or anything like that. So, um, I think more in terms of the harm from that, more about like for the first season, I interviewed Meredith Marin, who wrote a great,
Yeah.
she's written many memoirs, but she wrote that memoir called My Lie, A True Story of False Memory. And she's very frank. She writes about how she was reporting on these instances of child abuse and sexual abuse, and she's sort of changed her whole outlook. Every man she saw looked like a molester, and she gradually then, uh, she fell in love with a woman, discovered she was a lesbian, and she gradually started, reading about all this time. She had a lot of nightmares, and then started thinking, did I undergo abuse? So then she kind of, and writes about in the book very honestly, like kind of talked herself into this and had these memories that she never felt entirely sure of about her dad. And so 8 years went by, they didn't talk. By the time she reconnected with her dad, it was like right at the beginning of his Alzheimer's. So there was a lot of harm and damage in her life from this. But it was interesting. She she really believes that all of that was necessary for women and children to be taken seriously. So, I mean,
Mm,
I see the recovered memory movement
fascinating.
as, an overcorrection, excess, but some people
Sure.
see it as like that's what was needed to come out of this dark era of when, you know, children were, if they accused a parent of sexual abuse, they were removed from the home, or at
Ab
best.
Absolutely. Well, yeah, I mean, one thinks of go back and do a serious read of Toni Morrison's entire catalog. That is
Mm,
she is really talking about, like, the kind of the very difficult combination of poverty and incest,
right.
and how this is like incest in the family, or in family in especially in impoverished families, it was like a theme. I think the psychic impact of that was a theme in her work that is maybe underexplored. Um,
Yeah.
like more, you know what I mean? And like Faulkner too, her like spiritual counterpart, I think.
Right.
Um, yeah.
Well,
So
that's well, I talked about that a little bit in season 1, just like why was the idea of childhood sexual abuse and incest, why was it sort of like this sounds maybe
Let's
crass. I don't mean it that way. Why was it popular in the late 80s? And that's because it had been really trickling up from these consciousness raising that were necessary and needed. But it
right.
became the kind of thing that was sort of, I remember when The Color Purple came out and, as a
Mhm.
big movie event and just lots of, you could watch an after school special, which for young people was literally beyond. And since there was very limited entertainment, most kids would be watching that
No,
show
yeah,
or on during prime time about, incest, child abuse, a lot just more consciousness raising. And it sort of filtered into the consciousness. And then I guess we do with that what we do with things in our society is we kind of create diagnoses out of them.
totally. And yeah, I mean, this is, you know what this is reminding me of? Like the kind of pendulum, the overcorrection, the backlash, the
Yeah.
reaction, this is such a common social phenomenon. It feels worth mentioning this. This is like, I think over a decade ago now, so I don't feel weird about it. But I went to a lecture by the novelist Marilyn Robinson. Well, it was multiple lectures because it was a class on Faulkner.
Oh,
And I sat in the Sound and the Fury class and listened to her talk about how there's no incest in that book. It's not incest. Psychoanalysis ruined
oh,
the Aristotelian concept of friendship and the Platonic
wow.
concept of
Yeah.
love. It was 2014.
Yeah.
And
Yeah, so
and
that's overcorrecting
yeah,
from previous analyses. Yeah.
exactly. Yeah, so I remember like a friend coming up to me afterwards and he was like, she did she has she read a different book? You know, and it was like
Right.
kind of gobsmacking, but we, of course we're in an academic setting. This is another part of this, right? We're in an academic setting, so we cannot question the
Oh,
authority.
mhm.
But and it's like friggin' Marilyn Robinson, but she got up there, she's like, "There's no incest in Faulkner," and we were like, "Ah, well." So you're just what you're saying, right? There's like this like, whoa, intense consciousness raising to the point
Yeah.
of contagion, and in what it was a lot. And there's also that reaction, the, denial. So, yeah, I totally see how the recovered memories, mapped onto that. I thank you for bringing up, the Meredith Marin. I
Oh,
always
Marin.
forget her
Yeah,
last
yeah.
name. Marin, thank you. She's a fantastic example of someone who experienced what could be described as a type of, like, harm, behavioral health
Yes.
harm being encouraged in this. Um, I really wanna bring up the case of Jennifer Freyd,
Yeah.
Freyd.
Now I'm
Jennifer
never entirely sure how to pronounce her name.
I'm
I
not
think
sure
I've
how to
said it
pronounce her
wrong every
name.
single time, but yeah.
I'm probably saying it wrong right now, yeah. But Jennifer Freyd, who is, the adult daughter, of Peter and Pamela Freyd. So this is a fascinating case. This is a, family in the late '80s and early '90s. Jennifer is a professor, so are her parents. Her father's a professor of math at Yale. Jennifer teaches whatever, I can't even remember, maybe it's like UPenn or something, right? They are kind of a upper middle class, very academic family. Jennifer accuses her father of sexual abuse. She recovers memories of him abusing her, supposedly allegedly,
Mhm.
and then this is so important, dedicates her entire scholarly life to this branch of the recovered memories branch of feminism. Peter and his wife Pamela subsequently found the False Memory Syndrome Foundation
Mhm.
because they were, of course, reputationally, financially, you name it, negatively impacted by this. Jenna, it's so, and you talk about this case and you cover it so amazingly in the first season, but I'm really, really, really interested in a few factors of this. First and foremost, the class. Second, the environment. They're all
Oh, yeah.
academics.
Right.
Third, the age when she made the accusation, early 30s. Please,
Yeah, yeah,
I want to
I
hear
do
your
think
take.
I do think there's something about class to this, and I haven't really gotten into
Yes.
this. I thought I would this season talking about social contagion and, how we emulate people of different, maybe we wanna be kind of better ourselves kind of, and so that's what who we're looking to imitate. But, I do remember reading, and I can't find it to cite, but that, people of upper middle class, would have had, recovered memories of abuse, and then sort of lower middle
Yes.
class would have said they were abducted by aliens, at this particular moment, say in like
Okay,
1992,
interesting.
it's a little bit tongue in cheek, but, there was a
Still,
certain element that you're picking up on about her parents being academics. Yeah, I really felt like that whole family seems kind of tragic. That they both turned it into their whole life's work. And people may not know, but Jennifer has developed, I was going to say invented, but she came up with the acronym in psychology DARVO.
she's the yes, I know, I was so shocked.
Deny, accuse, reverse victim offender. So it's meant to be if when you accuse someone of really anything, I guess, in this model, then these are they will use Darvo back on you, accuse
Yes.
you of accusing them somehow. So, and I see Darvo being invoked many times, in online
Ugh.
discourse.
And the
And
thing though,
so,
Jenna,
yeah,
Darvo is true. Darvo's describes something real, I just wanna say,
yeah.
and I'm just so fascinated that it came from this place. Go on,
Oh
yeah.
yeah, yeah. I mean, I can't say I've ever been Darvoed or vice versa, but who knows? And then so the parents, they all have a similar personality in that they wanted to dig in and kind of make this, in my opinion, a little bit public. That the parents
Mhm.
turn this into their cause of their life, and they really they could have, the original accusations that Jennifer wrote in a psychology journal, which is her profession. So they just seem to have kind of a total melding of profession and personal. That her mother interpreted it, that they felt that they would be too exposed. So they came back and publicly said, no, this isn't us, and underwent
Yep.
a lie detector test. And I've read a lot of articles about them. Their family seems like it was kind of weird, I don't know what happened in the Freud's home, but it was kind of a wild chapter in the whole recovered memory movement. I called them the first family of this because in one
Yes.
family they had both aspects. And the False
Yes.
Memory Syndrome Foundation had a lot of really wise publications. But ultimately, when you read about the False Memory Syndrome Foundation, some people who were accused during that time were not falsely accused, and so they would go and want succor at the within the
Uh,
arms of the False Memory Syndrome Foundation. So it's all kind of
totally.
a little unsavory.
Yes. Oh gosh, and it's I mean, not even to begin to touch on that because that's such a real phenomenon, but it feels like it feels so important for me to go back to this upper middle class family made this socially contagious phenomenon
Yes.
the kind of the bread and butter of their careers, and I think, reflecting on my own situation, this is why, by the way, everyone listening, I became very keen on addressing estrangement and what's going on
Oh
with
yeah.
estrangement, not because I don't believe there are situations in which estrangement is extremely necessary. And there are many.
Hmm.
Don't get me wrong on that, I and that's a different conversation for a different day, but I think that the estrangement that happened in the Frades family and the fact that the parents, I think the father might have passed and there was
Yeah.
never reconciliation. Yeah. It felt to me like and again, I don't know their life, but it felt to me like this theory became a heuristic for Jennifer to describe some difficult stuff that was going on in the dynamic. And
Hmm.
I was kinda haunted by the situation because I came out as trans when I was her age as
Oh.
a tenure track professor.
Oh, interesting.
And
Yeah, I can
yes,
see why
and it
you feel it that
was
way. Yeah.
yeah, and and this isn't I'm not trying to impugn the family unit in any way, but
Yeah, they're
I
probably they're a
was
little bit reactive. Yeah.
oh, no, well, here, bear with me.
Yeah.
I was plenty reactive, but the broad thing I felt like I was trying to do, Jenna, was be like, man, I felt ill at ease in the suburb, right, growing up, or I
Mhm.
felt ill at ease with like all this just professional managerial class achievement and what was expected of me in that and what's expected of women and girls in that. And so,
Mhm.
yeah, I mean, right, like I had my like, oh, I'm mad stuff, so it was so delayed though. And dysphoria presented itself as like, oh my God, this is like such a helpful heuristic. And
Yeah.
someone for whom transition was not helpful, ended up not being helpful, but I was like, "Oh, hell yeah. This explains it all. I'm already gay, right? Like, I'm already, like, gender nonconforming." And that was a huge sticking point for me in the kind of PMC, suburban,
Mhm.
Ivy,
Mhm.
whatever spaces that I was in, the prestige spaces that I was, like, told that I needed to move through. And so, yeah, I mean, I think every kid is like, whatever, like, "Oh, I'm gonna stick it to the man," and the man is their parents. But I really saw myself in Jennifer Freyd, and I became terrified. Um,
Yeah.
because I was like, that's not a situation that I want in my life, and this is a heuristic that I think she used to just explain how things felt hard, and for
Yeah.
me, that was a heuristic I used to explain how things felt hard, and I was like, "Well, there's no way I'm gonna let this fracture my relationship with my parents, because mine personally is not a situation where
Yeah.
estrangement is remotely merited, right? But that's what's so fascinating is like you saw all these estrangements happening
Right.
way more than I think, were for like legitimate, like, holy crap, I need to be safe here.
Right.
And that's again,
Yeah,
that's what
like, it's like
pulled me back to
things
your
2 things can be true at one time, like,
Yes. Yes.
you can have terrible abusive parents, and your roommate might not, like, I mean, I just think in the case of my, experience, because it was around I have noticed on, Substack or social media about family estrangement kind of coming back up into the sort of zeitgeist. And,
Mhm.
I do remember in the early '90s, a roommate reading about toxic parents, and just that
There it
was,
is
like,
again. Yep.
kind of like a shocking framing to me, like, wow, and, so I think it is a lot of stuff keeps cycling through our culture and repeating.
Absolutely. And I want to take a moment to shout out to the wonderful comments we've been getting. I'm always excited to go into the class discourse and the PMC. And yes, agree with you, Elizabeth. Good girls who don't create enough trouble as teenagers just defer the big explosion. I
Mhm.
is I oh, hard
Oh,
relate
I don't
to
see any
that.
of your comments. Okay, so I don't see any of
Well,
the
I
comments.
I will keep you apprised,
Okay,
Jenna, because that's
okay.
my next thing is if anyone has questions for Jenna, please, please, please feel free to type them into the live chat. I'll be sure to mention them. I, of course, have more questions for you, but just so everyone knows, you can feel free to ask. Jenna, this actually brings me back to your novel that you've
Okay.
written about so this is now your experience.
Well,
Like
yeah.
based on it, right? In this kind of recovered memories era. Can you talk more about that?
Sure. I
Like
mean,
your
my novel is on submission, so, it
Yeah.
feels like sort of
Ooh,
like
somebody
this,
buy it.
curse, you can't talk about, or I don't know, like, there's a lot of,
That's right.
voodoo around that.
That is a hard
But,
place, yeah.
um, yeah, because I recognize I think, but, I would never have thought I would be here talking publicly about this topic, like, these things gradually, take one over. But,
Yeah. Yeah.
when I first started, researching this era, a novel made the most sense for me because I was uncomfortable. I didn't have, traumatic past, and I didn't, generate false, memories. Um, but I wanted to talk about the idea of not speaking up and going along with, things that felt right, but then also there was always this feeling of like, so I feel like that's a theme for me is not speaking
Mm.
up. And so, in the book, I have two main protagonists, one who, let's see, developed a memory that was, she never felt comfortable with. And there was sort of an accidental way it was disclosed to her family, and terrible things happened as a result of that. And then she sort of lived her life trying and running from that episode, estranged from her family, actually spends her professional life dealing with memory, neuroscience, but the guilt of having created a memory and being aware of that, not really being able to face it. And then her roommate best friend is someone that she sort of assumes is in the same camp with her, but actually she has experienced abuse. So I wanted to show the nuance of these of the situation. So that it in some ways, I feel like the movements like the recovered memory movement, they do a disservice to actual victims,
Mm,
because
yeah.
it creates it as a fad then. So what if you're 5 years late to
Right.
the fad? You're going to say, oh,
Right.
I will have this happen to me, and maybe, you're less likely to be believed.
Yeah.
So that's what
Oh,
I tried
yeah.
to express in the novel.
I need to see that on the shelves. We gotta get this book published. Um, Jenna, listening to your podcast and reading your Substack, for which you've written some really great essays, and I know you have some really awesome ones coming as well. I find myself thinking she has such a skill for saying the unsayable and making it empirical. And I feel like you probably know what I mean by that, but if you if you don't, I could elaborate. But if you do, does that resonate with you?
Well, I'm very
And if so,
flattered.
how so?
I'm very flattered to hear that. I do. I feel like maybe that gets back a little bit to my job and being a pathologist, which is that I really want to boil things down to what actually happened. I sort of joked in the
Uh,
podcast that I always kind of saying, well, before we can talk about this, we need to know what's the definition, and what's
yeah,
the permutations of the definition, and how are people misusing the definition. So I just think that I want to kind of, and it's not really, doesn't make me such an easy person to get along with, but I keep wanting to boil things down to like the root cause. Like I remember in medical school, people talking about, you can get cervical cancer from HPV. And I was like, but how? And then, you go down each
right,
level to the point where I need to know, oh, it's these certain viral particles that interact with the DNA at these points. So I feel like I approach a lot of questions that same way. Like I want to, which is why I get very frustrated with the mind body connection, because that doesn't exist so much. But I feel like, and also maybe with, um, certainly with this podcast, I don't feel like I have any animus in dealing with these subjects. I wasn't wronged. I'm just very curious, and I think I harbor some real reluctance to obviously a lot of how we live our lives is socially constructed, but a part of me wants to always interrogate that in myself, and find out, what is real. Were I to live 250 years ago, would I, have had an eating disorder when I was, 13, or, whatever it always interests me, like how much of how we experience our world is based on our society, and how much is sort of integral to ourselves. Which actually, now that I'm finishing up the season, I would say very little is integral to ourselves,
yeah.
which is a
Back to the
difficult
yin
place.
hacking,
Yeah.
right?
Yeah.
Yeah, yeah. The philosophy of science. I mean, I personally, I'm very interested in like the construct of the self, the concept of selfhood. How can one know thyself? But I think that it's so it's so hard to analyze and to get like it's so hard to you have to be a bit of a substance dualist. You can't be a pure materialist. And I think that's where, a lot of the like the empirical science stands on the kind of on the edge of the cliff. And I think reasonably so, because it's like, well, if the rubber is gonna meet the road at the point where everyone's falsely misdiagnosing themselves with ADHD or autism or
Mhm.
whatever, then
Yeah.
maybe we need to like pull back. But
You
I
don't think
think
we're
just
there already?
No, we're there already.
Okay, yeah.
We're there already, but what I'm saying is, for me, that doesn't I think for some people that means like, "Oh god, knowing thyself is just a this is all ridiculous, psychoanalysis, throw it out the window." For
Oh, I
me,
see.
I'm still plenty interested in those topics. I see it as
Yes.
kind of yeah,
Oh, yes, there's yeah, like, I mean, I feel like I am critical now of, like, the psychological paradigm, that
mm,
we have ingested ever since, Freud, but, that it shapes my ways of thinking in ways I'm not aware of. But I do feel like, for better for worse, a lot of psychology is where all of our deep human philosophical questions have landed, so it's very interesting to me, questions of ourself um, and identity, I guess, is the modern explanation.
yes, it's still very to be very worthy questions, like, we're not Elizabeth Bennet, we're not Darcy, we can't go
Right,
back. Like,
right.
the mind looks different now. A question from Julia, she's wondering, what does, "everything is memory" mean? From the early part of the discussion, Jenna, do you remember we were talking about, like, suddenly everything could be a
Oh,
memory?
yes.
Can you say a bit more about
Yes.
that?
Yeah, just like, well, going back to the olden days of, like, 1988, and I don't hear girls talk this way anymore, but when I was that age, girls would often say, "Oh, I feel so fat." And luckily, that
Mm,
construction seems to have kind of gone away.
thank God.
But
That was still great
yeah, I'm sure
tradition, I
there's
was
new and more
teenager.
horrible
Yeah.
ones. But like, and so I would think like, oh, I feel fat. I don't want to look at myself in a bathing suit in the mirror, and then my roommates and my friends introduced the idea of like, oh, well, you don't like your thighs because you feel ashamed of your body. And why would you feel ashamed of your body unless something shameful happened to you? Have you thought about that?
Oh, boy.
Like that feeling of bodily revulsion, like,
Mhm.
I would say like, "Oh, I can't wear a tank top, I'm too fat," or whatever it was, and then they would say, "Oh, but you feel revulsed by your body um, because something revolting happened to you." So that's just one example of like
Mm.
everything's a memory. So like the idea of a certain smell. People get caught up. I mean, memory science is so complicated, especially around these kind of sense things. But the idea of like, uh, and this is really ingrained, so I don't want to, but the idea that maybe your stomach clenches when you walk by a certain corner, you should investigate that, or
Mm.
in your
Mhm.
hometown, or, um, but the feeling about my body, that was one thing for sure, and then forgetting what I was about to say, or having now we would say like, oh, I'm insecurely attached, that would
Right.
be I would say, "Are you mad at me? Are you mad at me?" Like, "Oh, well, Phyllis, our therapist says if you're so insecure, that's a sign that you were abused." So that sort of everything became evidence. And then one of the kind of, I think it's like called a, Kafka trap is when you say, "Oh, I don't have any memories of being abused." And then the response to that is, "Well, that's really common. You must have blocked it out." So, you're sort of stuck. And especially, at 19, I was very suggestible. And I think, oh my gosh, that's a sign. Well, maybe I should
Yeah.
do some journaling and try to get at this. So that's kind
Yeah.
of what I mean by that everything became a memory. And Meredith Marin makes a joke in her interview with me talking about her memoir where she says, the courage to heal listed all these symptoms. And she jokes and says, you don't like mayonnaise, that's a sign.
That but totally. I mean, I, like there's so much that comes up for me from that. The creation anything could be a sign of past abuse, right? For me,
Yes.
anything could be a sign of dysphoria. It was the catch-all
Oh, that's
trawler's
so
net for
interesting.
me. Yes, like, I had a therapist who was like, "I will absolutely not diagnose you with this." I think reasonably so, right? Given what I know about myself now is what I'm saying.
Mhm, mhm.
And yet there was this it to borrow a theorist's term, a baggy there's this baggy this very spacious, capacious
Oh,
concept
yeah,
of gender dysphoria that anything could fit into. And
right.
so it's so different, Jenna, from like what I hear you describe how these false memories could be constructed or even just hinted at, it's so different from the old kind of Madeline in the tea, the Proustian
Oh,
involuntary memory.
yeah.
And what's so important about that for me is that, the narrator of Swan's Way is simply remembering his childhood in Cambrai un like bidden. Like he's not like, I need to think about this, or like, oh, I don't want to look at that tree. Is that because I'm remembering Swan and Odette?
Oh,
No.
right.
He dips the Madeline in the tea and it just comes back. And that's a different concept of sense memory than, oh, your stomach's clenching around the corner. Do you think your body's keeping the score? What's the
Yeah,
score?
yeah, yeah.
You know?
Oh,
And
dear, yeah. I don't know,
yeah, we
I
don't
don't
have to
have
get
the
into
firepower to debunk,
we don't
the
have to
body
get
keeps the
into
score.
him.
But
Yeah.
just for listeners, if they're curious, it is a work of pseudoscience that is number 1 on the bestseller list, and it's a direct, um, work really from this whole era of the recovered memories and kind of the worst of Freudianism.
Pop Freudianism, right?
Yeah,
It's making a comeback or has made a comeback.
yeah.
Well, to we'll take it away from good old Bessel van der Kolk. We'll go to I think, my last question for you, Jenna, is it's, much chiller. I'm wondering if you could share, like a behind the scenes, funny or fascinating experience you had, from any moments reporting or researching the memory hole. You've interviewed so many great people.
Mhm.
You've had some really, really, really cool kind of research rabbit holes you've gone down, I'm sure. Could you share a
Yeah.
couple of those with us?
Well, for me, as a aspiring writer, and podcast fan, I just decided to do the podcast, on my own. So I kind of think
Mhm.
it's a fun outlet. So for writers to even consider, I just do it I create a little closet for myself, and and so that has been very, fun and empowering experience to do. However, it is a big time sink. The benefit is that you can email very well-known people, and many of them say no, but many of them will reply and say,
Many of
"Sure,
them.
I'll be
Yeah.
interviewed." And,
Yeah.
a lot of them haven't been interviewed for many years, especially with the recovered memory movement, so they're very they have a lot to say, and I think also we talked a little bit about that churn in pop culture and the zeitgeist and all this. There are a lot of voices that a lot of these, rebuilding the wheel, or what's the phrase? A lot of these questions have already been answered before in the
Mm,
past. So I love talking to Frederick Cruz. So I
mm,
really recommend that kind of wry, no bullshit academic English professor. That's from another era and not to be seen again. And then, one of the fun things that I did this season was I got a friend of mine to come with me to a local museum of medical technology called the Bakken Museum here in Minneapolis. And I
my
felt like
god,
I'm like a real podcaster because I was recording on site, and
so cool.
uh, my I would say that the podcast that I really love and would love to emulate is called Articles of Interest about
Mm,
fashion with Avery Trufelman. And I feel just as exciting as Avery Trufelman. So, but it was really interesting at the Museum of Medical Technology. We're in the vault, it's just chock a block full with old medical devices, like weird things.
mm,
You step into this mirrored box and you get blasted with some kind of light, the man who started the museum, Earl Bakken, also had a real fascination with Frankenstein. So, but it was really there, surrounded by all these implements. And at the time, cutting edge technology that I finally really understood, like the whole idea of the placebo and the mind body, and that the fact that why any of these worked at different times is a lot of it is because of the placebo and the power of suggestion. So,
mm.
so that was a really fun experience to do.
Oh my gosh. Well, I know where I'm going when I'm in
Oh,
Minneapolis.
yeah.
That's absolutely fascinating. Jenna, thank you so much for coming on my Substack Live author podcast situation. Folks, if you have not subscribed to Jenna yet, please do. She's Jenna with one N. And please add the memory hole on, Apple Podcasts or like Spotify. Jenna, what's the best way to support your podcast? How can people support this podcast and support you?
Well, everything I've learned from podcast experts is that the Apple Podcast app is where podcasts get attention, traction. So
Great.
any, thumbs up, hearts, comments, recommendations you can do from the Apple Podcast app, the better.
Perfect.
Yeah, I
Yes,
really
so Apple
appreciate it.
Podcast app, send it out to people and
Mhm.
then subscribe to Jenna. I know she's got some really cool essays coming down the pipe soon too, so you're going to look forward to reading those, I bet. Once again, thank you, Jenna. Thank you all
Thank
for
you.
tuning in
Thanks,
and
Rob.
yes, and this will be live very soon.
Okay.
Bye.
Bye.